Hello, everyone. My name is Carissa Brewster. I am the writer for Whitman Partners, and we are starting our 40 Fast and Future Leaders of Surgical Services interview series for 2023. And today we have Jillian Smith. Welcome, Jillian.
Thank you.
You're welcome. And can you tell everyone your current position and the facility that you currently work at?
My current position is Director of Nursing, and I work at Essentia Health in St. Mary's Medical Center, Duluth, Minnesota.
Awesome. Awesome.
Oh gosh, I think right now the biggest professional challenge I've experienced is the kind of movement of healthcare to become leaner and trying to maintain a high quality of care. So as our resources are narrower, like not having enough nurses or surgical techs, or even not having enough EVS or, lab personnel, the nurses are kind of taking the brunt of having to step in and do those roles. And so how do we do that while maintaining a high quality of care? And of course, reimbursement is getting a little leaner. So that's also putting additional pressure. Naturally, I'm a transparent leader, so I just am always keeping them in the loop. So my kind of foundational strategy for success is making sure that I am touching base with my team at all levels, from the registration staff to, even tying in my colleagues in lab and rehab and HIM even. So I invite them to meetings once a month so they can kind of just share with us a piece of knowledge that maybe we didn't know so that we can kind of have the big picture mentality. But then I just touch on like the 4 primary pillars, which is the service we're providing for the community. So feedback we've received, where we're sitting with that, if we've seen trends up or down. We touch on our people. So who has anniversaries, who has birthdays, who's joined our team, who's retiring from our team. And they've kind of started their own initiatives to tie into that as far as how they recognize different people and welcome different people. And then we talk about our quality metrics. So we usually try to pick a few. I think it's really important not to focus on 15. I just pick maybe 1 or 2 and drive those. And then once we've got a good measure on it, we move to another metric that maybe might need work. And then the finance piece. I'm super transparent about here's what we did last month. Here's what our expenses were. Here's what our revenue was. We're doing great. Here's what we're going to do to try and drive this up. We're going to add another ENT provider, whatever. So I am always communicating that with them. And some people, I've heard resounding feedback that they appreciate it, although I anticipated it might bore some of them. I see a lot more engagement and them jumping in and saying, I'd like to work on this with you. So they started doing like cards that say, welcome to the team. And before somebody even starts, we mail it to their house that says, hey, Nate, welcome to the team. We're really excited to have you. And some people will put little jokes in there and different things like that, but it really makes them feel like they're a part of the team before they've even started. Oh gosh, this is going to sound so cheesy. My secret sauce or superpower is just listening to the team that works with me and using their strengths. So I'm not going to claim that I'm the knower of all things and being of all knowledge. I lean on my experts and then I partner with them and support them as a resource and kind of combine my own thought process to get better outcomes. I think it's primarily unhealthy practices. If we've, I was just talking to somebody about this, is you have to establish accountability for people's behaviors and their actions from ill calls. When you've got a team that's saying we're always carrying this person's weight and there's no accountability, then you start seeing everybody that will start doing it. So that one's a little easier because it's objective and it's something you can measure and kind of establish accountability easily. It's not personal, but also behaviors. If you're seeing people that are just kind of like tucking away and kind of doing things and even spreading rumors about people, but venting, so to speak, and it's becoming toxic, it really unravels quickly and spreads across the team. So just identifying those people, establishing expectations and accountability. And if they're not willing to improve their behaviors and move up, then they need to move out and find their happiness somewhere else. And that sounds really mean and nice at the same time, but I've had to do that. And it's amazing how in the moment it might be hard to lose those team members, but in the long run, it's probably better for them and for the team. And it's amazing when you can see that culture of positivity and being honest with each other, but not being mean. So I think that's the biggest area in healthcare. I think quickly venting can turn into unproductive conversations and can become negative. I think in some areas we're advanced when you think about robotics, not just the Da Vinci, but like the orthopedic robots, we're advanced, but I think we're also lagging in other areas. It varies on which facility you're working with. Our EMRs are quite advanced and have a lot of capacity to notify patients and to send them reminders and to ask them questions to make things more efficient and to also help us with making sure our schedule is efficient so that if they got ill, that we're catching it early enough to fill their spot. But I think there's opportunities definitely to dive into like AI more in surgery because there's different triaging components in AI that you can do as far as scheduling and coordinating, who needs surgery first, who can wait, how do you best promote a functional schedule. And I really like the idea of a more robust coordination of their procedures because how many times the patients come in for surgery. I'll give you an example of like a total joint replacement. They need to come in, they need their CT scans if they're going to have a robot used. They need to come in for labs. They need to come in for an HMP. For a while, they had to come in for a COVID test. We also do, we call it prehab, where they come in and learn some exercises beforehand so they're successful. And at one point in time, we were doing joint teaching where we're also, and they're coming in for all these appointments. And it really should be seamless. We should be able to coordinate this. Hey, come in on Tuesday and we're going to run through everything with you. But instead, sometimes they get a call from imaging, they get a call from clinic, they get a call from rehab. And I just feel like that's the biggest opportunity in my experience is being able to really channel how much of this can we do virtually, how much of this needs to be done hands-on, and how can we streamline so they're driving in once and not driving in 4 times and getting 4 calls, because that really feels like each part of our body is disconnected instead of this seamless kind of coordination. So I think that's an opportunity in most places I've seen. Right now, I think at the forefront is like employee retention and resiliency. It really like pains me to see people, their stress responses, come out at work and be concerned about them for their burnout. So I think that's probably one of my highest priorities. But I love partnering with like other units. I like partnering with like a rehab and lab and HIM. So that collaborative effort is kind of probably priority 2. I think the biggest challenge is going to be offsetting the expenses. So, as far as how to channel revenue, I think we can look into those resources. There's specialists that now with AI and like the telehealth kind of world, we could start offering different providers that normally you wouldn't have access to unless you were living in that zone. We could start offering those resources and filling out how or finding out how to bill for them and make sure that we can charge that it's fair for the patient, but we're capturing those expenses. I think there's opportunity to capture expenses from the nursing world too, as far as when patients are coming in and interacting for the nurse only visits. Even from the surgery perspective, if they're coming in and doing a class, is there a way we can capture some revenue for that? Or even maybe we're capturing revenue because we're building a relationship and now they want to receive their primary care there. So it's not just the surgery experience, but that's one opportunity where they're coming in your door and you might be able to earn their business as far as who they receive their health care from moving forward. So I think right now my focus in surgery, my focus was recruiting providers. If I saw that we had an ENT who doesn't do, does a lot of sinus and nose stuff, but doesn't really do any middle ear and then making sure our recruiting strategy is saying, do we have a need for this in our community? And if we do, then channeling that recruiting strategy to say, can we bring in a middle ear guy? Do we share them with another facilities if we don't need them that much so that we're getting best use out of them, but we're also supporting our partners in our local facilities. And then also collaborating with them. I do think there's also great opportunity. One idea I've always had is for surgery departments is we always buy these instruments. We might use them once a month. Could we partner with other organizations nearby, whether we're an affiliate or not, partner with them to say, I'm going to purchase this set and we're going to have a shared kind of compliance with using this set. I've done that working in a critical access hospital. You have to have friends where it's like, hey, our autoclave went down and I need a septo set for tomorrow. Otherwise, we can't do surgery. And, they support you in how to do that. So I think building those relationships, I think there's an opportunity definitely for purchasing and not wasting money on instruments and equipment that you don't use as frequently and maybe more of a shared use program. That's something I would love to look into. I think the hardest is it varies. There's different levels of people their thought is to their education and their background is not to just trust what you're saying, but to challenge you. Those are always difficult people, but they're always, I find, the most rewarding because you learn something as they're challenging you about yourself and about them. But right now, in my experience, the most difficult party to win over truly is when you're coming to an organization where there was maybe a previous incident of mistrust, and you're trying to come in and say, we need to build a foundational relationship of trust both ways, and they're asking for trust when it's been broken is difficult. And regardless of whether it was you or not, or whether it was an event that occurred in the past, when you've got this party that's saying, I don't trust you, you can't get anything done. So I feel like my primary goal when I come into a new role or a new organization is building trust. And sometimes that can be incredibly difficult if there's past history.
Well, thank you, Jillian, for joining me today. It was awesome to get to talk to you more.